Hello dear vet, welcome to bdvets, next generation vets, online vet schools, free online veterinary learning center. You know that bdvets.com is continuously dedicated to its development of professions and service, education and research is the theme of bdvets.com. Share, learn, practice also. Today I am here to discuss about botulism, limber neck or western dark sickness, poultry diseases, especially for in duck. And I have found some cases in botulism in the field, and I am sharing here. Please don't take me as a teacher. I am also a learner like you. I am continuously learning, and I am making these videos to share my field experiences with you. So let's start. Botulism, you know that is a bacterial diseases, and so one thing should I mention that I am making this video though I am not fluent in English and proficient in English, and from my pronunciations may not be perfect, but I am trying to making these videos because of I believe that we should not express our professional secrets or technical sensitive issues to publicly, so that I am trying to this making videos in English languages. That might be because of my pronunciations and my influence in English, there may be trouble to understand some of issues or things or topics, or maybe pardon me for these reasons. Okay, let's start. Botulism, you know that it's a bacterial disease, and Clostridium, causal effect of Clostridium botulism, age group affected. It is most avian species, ducks, especially ducks, botulism. And in my field experiences in poultry, chicken, turkeys, on pigeons, rarely I found this botulism. And transmissions, you know that injections of toxin, it's a Clostridium botulism is mainly produces a toxin, and this toxin is responsible for botulism. And insects or maggots, these are the most vital or striking factors for transmitting these diseases. Feeding or death, decay, carcass. Okay, clinical signs of botulism: paralysis of legs. See that this duck, it's a paralysis of legs, and wings, this is a droppy wings, paralysis of droppy wings. I have a video about this duck already posted on our bdvets.com at bdvets TV videos sections. Okay, eyelids are predominant, and eyelids may be found in the predominant. You find that. And another is paralysis progressions cranially from legs to eyelids, paralysis eyelids. Affected bird appear firstly sitting on hocks and reluctant to move, or appear lame, dropped wings, extended neck, ruffled feathers, and fall out with handling. See these pictures, which is taken from field cases as droppy wings, sitting on hawk, and bent neck, and ruffled feathers. All these are included here. You know that the atlas or pictures tells many things. In our class, when we were the student, we found that that she paper class notes, which is lack of atlases or the pictures. If I found the pictures, that will help me, and I am seeking for these pictures, and for that reasons I, from my 10 years of experiences, I try to collect my clinical cases, pictures and videos that are sharing to you. Broiler chickens are showing diarrhea and excess urates and loss of droppings. Mortality and morbidity are related to the amount of ingested toxins. Death 12 to 24 hours. It's a sudden death occurs in case of if you see or found any cases of duck, they are especially in the young ages. You found that the ducks are died 10, 12, 14 or many others ducks will die in suddenly in that cases. And next is lesions of botulism. So yes, it's a very important thing. If you do postmortem on a duck, you cannot find any gross lesions on their viscera or any other lesions, and you should diagnosis make a tentative diagnosis based on the clinical science. And another things I will share you with this which is very important for diagnosis. And maggots of fly, blown carcasses or feathers can be found in crop of dead or affected birds. And the treatment of botulism. Before going to the treatment, I told you that typical signs or typical factors involved in diagnosis the botulism is the summer seasons, especially in the June, May, April, May, June. These one hot seasons in summer seasons in our country. That is called I call in Bengali I call Chaitra Boishak. In that in that 2 months in our country botulism is very common because of sufficient amount of clean water. And you know that in Chaitra March in our country there is a lack of rain, and there are some stagnant water, and environment is also very hot temperature. For that reasons ducks got developed botulism because of ingestion of toxins. I will show you video that will help you to understand how can ducks get botulism in the summer months. Okay, treatment. No treatment but rapid withdrawal of toxicated food. Yes, there is a very in case of botulism the prognosis is very poor, but you will find that there is a treatment is not very effective. You can also use some salts or purgative or remove decomposed food from the intestines. In that cases I am using the toxin binder like PAs, hemicoPAs or ACDO, acidifier. These are trade name, and Biotronic AC4D from Grenada, and also Captox, any others. You will find these name of drugs in our bdvets.com online prescriptions platform. There is a disease list, and if you want to know more about the drug information, you can find bdvets.com's drug sections. So sodium selenite and vitamin E is also effective, and I give the suggestions that they also give the toxin binder and acidifier, and also with that saline solutions for neutralizing the toxin, and this is effective. And some preparations are also available in market that they are also salt with acidifier or organic acid. These are very effective. And in our country where is duck is common, like Hobiganj, Hobiganj and Kishorganj, in our area there is a common for duck farming, and they the farmer in this area uses turmeric oil also turmeric juice, And antibiotics included bacitracin 100 gram per ton of feed and streptomycin 1 gram of water may be value, but in this clinical trial or my field experiences, I found that these are drug is not very effective in case of botulism. Inoculations of antitoxins and free extracellular bound can be used treatment of valuable birds and no treatment of fed sodiums. Okay, what I call here that in the antibiotics, bacitracin or streptomycin, but in case of botulism, so you can use gentamicin. That you know that gentamicin is only effective only orally. When you give gentamicin in orally, that will affect only in intestine. This drug is not or nominal amount of absorbed from the intestine, and the treatment which I found very effective in case of botulism, I using for 2 years this drug in case of botulism in ducks. Yet Flow 200 Solutions, it's a Novivo marketing this drug. It's a fluorphenicol, and I use 1 ml 2 liter for 3 days continuously without any break. And it's very important when I use these drugs, don't mix any other drug or not any break. It's very important, and I found that I do not know why, but I found this drug better effective than others drug. Okay, so I told you that botulism is a very dangerous disease. So here is a bdvets.com online and next gen vet. If you next gen vet, there are our global learning center, online learning, free online learning center. And I told you that in case of botulism in dry season, it's a very important factors. I told you that I have taken these pictures few days ago on the field, and there is a stagnant water and it is not a clear or pure water and it's in this water the wastage of from the field or from the housing are also coming in this stagnant water, and it's a few amounts of water, and it is not much more, and it is not clear. And this water is a very important factor for spreading botulism in the duck. After eating this water, drinking this water, the duck may develop botulisms, and it's the very important factor. And I suggest the farmer, you should not keep the duck in a stagnant or a small amount of water or any unclean water. That's in these cases, and it is you know that in this season, summer season, so in the beginning of the summer seasons, and there is a insufficiency of water, and because of sufficient raining, there may be sometimes raining, and in a lower land, few waters are circumscribed, and these waters remains stagnant, and in the when duck it drinks this water, they got develop botulism. Okay, this is the factor. I told you that some this factor you will not find any book. It's an my experience and field experiences and others also, but I did not find any type of information in any books that in the summer seasons or in this seasons in stagnant water you may develop duck development botulisms. But in our slide you have to find that maggots and other toxins, injection of toxin may develop botulisms. So it's a very important factor. Okay, next you will find some other videos. I told you that many other videos, I saw all of the videos I have taken my field cases, and as a general veterinary practitioner, I have to deal with the different type of animals. So I have tried to collect these type of all the videos and atlases that will help you. When I was a student, I feel this lack of these materials. If I found these materials, that will help to me. Rhineck, lumbar, swelling, pigeons. There is a video also. Yes, there is a botulism video, but why this is not showing? Sorry, this is not playing. I'll try to find out why it is happened. Okay. Next, atlas. In atlas, you will find these pictures or clinical science images from my field cases. That will, I hope that will help you. I have lots of images. I am continuously or periodically posted these images. If you wanna, you can also post your images or videos in bdvets.com. bdvets.com, it's a platform for all and platform from veterinarian, and it's made by veterinarian. Thank you for everyone. Welcome to our next generation's veterinarian, a vet school without free, the future global leader. You are the I believe that we are veterinarian, the future leader of the world. So thank you everybody. Take care of yourself and your family. And if you watching our videos in YouTube, so please make a comment and also subscribe our channel, so that will help us to make our videos. Again, welcome to everybody.